So we've been talking about plantar fasciitis, and we're going to show you some methods of how you can treat it yourself. So typically when we're talking about plantar fasciitis, we're talking about pain on the inside portion of your foot through tension through the plantar fascia itself. So we're going to show you how to stretch out some of the tissue underneath, stretch out the calf bulk, and we're going to show you how to strengthen up your hip, because good hip stability will prevent any injury. So we're going to teach you how to perform an effective calf bulk stretch. The thing to remember when stretching your calf is that it's made up of two muscles, and so we stretch it in two different ways. The first way is we're going to stretch the longest part of the calf, which goes from the back of your knee all the way down and underneath your heel. So Ryan's going to take his leg back behind him. He's going to keep his heel in contact with the floor, and then he's going to lean into the stretch, and he should feel it in this portion of his leg. You feel that there? Mm-hmm. Of course you do. We're going to hold it for about 30 seconds minimum, and we're going to try and repeat 3 holds of 30 seconds. Okay, Ryan? Second way, we're going to flex at the knee, and we're going to bring the hip back over the heel, and you should feel the stretch a little lower down into the calf bulk. We're stretching the shorter soleus muscle, which goes from about here down and again underneath the calf. Again, same repetition format, at least 30 seconds, and aim for at least 3 stretches. Now, to get at the plantar fascia specifically, we can try and target that. So Ryan, if you step a little bit closer to the wall, Ryan's going to bring his toes against the wall, he's going to bring them up, and then he's going to press his foot down, bringing his knee into the wall, and you should feel the tension developing underneath the sole of the foot. Okay, so we're going to show you how to use the lacrosse ball and the foam roller to get some pressure through the calf bulk and help to release it. So we're going to put the ball on top of the step, and Ryan's going to put his muscle on top of the ball. Applying a little bit of downward pressure, he's going to move his ankle up and down, and he's going to do circular movements. Any movement really that's going to get the muscle to move along the ball and get a kind of flossing effect to release off the tissue. It should be uncomfortable, you should really feel it, and you want to try and aim for about 2 minutes at a time. Once you stop using the ball, that sensation of discomfort should settle down. We can also use the foam roller. If you've never used these before, they're an excellent piece of equipment. Same sort of time frame as with the lacrosse ball, we're aiming for about 2 minutes. The difference with the foam roller is it's a more generalised effect. So if you want to put your calf on top of there, Ryan. So he's just going to roll forward and back. We work from the bottom of the knee right along to kind of where the Achilles tendon forms. Again, around about 2 minutes at a time, and we can use the other leg to sit on top to provide a little bit more tension if that's required. Okay, now we're going to show you an exercise to strengthen up the hip. You may think that's strange given the fact we're talking about a foot problem, but strength around your hip is really important in terms of lower limb stability. So we're going to strengthen up a muscle called your posterior gluteus medius, which sits just on the side of the hip, and it's going to stop the leg from bowing in and causing undue stress further down the limb. So one of the best ways we find to do this, Ryan, if you want to take this arm forward and lean onto it, bend the top leg up, and he's going to lock his foot behind his knee and keep that foot in contact all the time. You'll notice that his body is slightly rotated forward, and that's what we want. And what Ryan's going to do now is lift his knee up toward the ceiling to about here, hold it for a second and gently lower down. Now ideally what he's aiming for is about 3 sets of 15 repetitions, but that will be dependent on how much control you have and how easy or difficult you find it. You'll need to alter the repetitions accordingly. What we want to avoid when Ryan brings his leg up is going so far that the hips rotate backwards. The spine should always be in a nice neutral position and hips rotated forward. Hope that's helpful. Crack on.